Hi, I'm Jane Marks, and this is From the Heart. You know, each week we continue to open up the conversation on issues that matter to teenagers and their families. We're so happy to have joining us this week Dr. Cynthia T. and her assistant, Gabrielle Alexandra. Dr. T is a board-certified dermatologist and fellow of the American Academy of Dermatology. She's got more than 30 years of experience in pediatric dermatology, skin care, cosmetic procedures, and she's also a published author. So thank you guys so much for joining us today. You know, Dr. T, for the last few months, you know, our concerns as a nation has been focused primarily on COVID and on safety and health of our families. And, you know, we don't often think of how COVID has impacted, you know, just public health issues, but I do know one thing. It has indeed affected our skin. You know, the truth is that we talked about face masks, we talked about maskne, and all sorts of rashes that have occurred since COVID. And so, what conditions have been amplified these last 2 years? Because we're still, you know, struggling with COVID.
Well, you know, Jane, you're right. Maskne is a big thing. A lot of people wearing masks all day long, and they're getting rashes and getting acne under their mask. And we see quite some of that. COVID also caused hair loss, so we see quite some of that. What else do we see, Gabby?
I'd say an influx of inflammatory diseases like hidradenitis.
Stop. We don't know what hidradenitis is. What is that?
That is acne, but severe acne that is under your armpit, in your groin area, and under your breast. It's a very devastating disease because people are very ashamed about it.
So these conditions, as they come up, so they have to get very severe until, you know, by the time they call your office, are they really at risk? I mean, do they call you at the beginning like me? I'm sort of a nervous Nelly. I would call it at the beginning.
For the most part, patients wait until it gets pretty severe, and then that's when they make that phone call. So it's more like we're picking up the pieces and trying to get them back to that high quality of life.
You know, because it has been such a big issue, have patients postponed other kinds of concerns? I mean, have you noticed that they just have let most other things go? Is it mostly COVID related?
Some people do postpone a lot of procedures like skin check, healthy skin check, and but most people do not want to postpone. A lot of people still insist of coming in. You know.
So even during COVID, you still got multiple calls.
Yeah.
Well, it had to be scary at first when we didn't know that much about COVID, you know, and you all must have taken what, multiple precautions.
Yes, we did a lot of virtual consult with a computer, and that was thrown at us at the beginning. We never done that before, and we did that within a few days, right, Gabby? We started immediately like doing consult over the computer.
Now, is that something that patients can still look forward to? Because for us, you know, it's still hard to get in, and I think there's a little bit more efficiency because even in my family therapy practice, I do a lot of telemedicine.
Absolutely, we still do that, but most people like to be seen in person. And we could definitely give better advice in person because, you know, I like to touch the skin. I like to look at the skin closely from different angle, from different view, and you can't do that from a camera. You know, we could judge how a follow-up goes, how your acne is, how your rash was, because I've seen it 2 weeks earlier or a month earlier, so let me see how it looked like now. That is very easy to do, but to diagnose a growth or a new acne, it is very difficult because I like to see like under your you know, your clothes and on your upper arm and the back, and that is not very good visible for the camera.
And you know, that's important because when we think of healthy skin checks, you know, all of these things are critical, you know, as opposed to us coming in for that one mark or that one tick bite or that one, you know, odd looking, you know, experience. Now, it's interesting to me because when you think in terms of skin care, you know, especially during COVID, one of the things you mentioned, which I think has been critical for a lot of people in this country, is hair loss. Even when you didn't have COVID, what I found among my patients is experiencing hair loss. Now,
That sounds like, it seems like it's increasing too, but probably just because of more awareness. And I'm happy because we could offer a little bit more now with some treatment that we could offer. In the past, it was just like, well, you lose your hair, it's too bad. There's not much you could do except for a hair transplant and wigs. And we have a little bit more offering now. Not quite. We can't grow everything back, but there is a little hope.
When talking about hair loss, is that something that they come directly in? Because I'm curious about this. So they come to the dermatologist. Are there times when they, tell you, define the problem, but then after she leaves the room, they'll come to you and say, well, I forgot to tell you about this?
Happens all the time.
I bet it does.
But hair loss, a lot of times patients will call on the phone and that's their chief complaint. And you don't realize until you get a patient that's experiencing hair loss or alopecia that it affects all aspects of their life. They start to wear wigs, they're self-conscious, they, decide not to participate in certain activities because they don't want to take off that wig or that headband or that head wrap. So we also not only treat the medical aspect of hair loss, we also have to
take a deep dive in the psychological aspects.
Absolutely.
Right. And I think that happens in almost every medical field, that you're looking at the whole person. Now, how much of some of these conditions that you're seeing from a skin standpoint do you think are just stress-based or psychologically based?
I think that stress or psychological stress is aggravating it, but they have that in them. They have the predisposition to have them, and it is aggravated by stress. I don't think that stress is the main cause of the condition.
That's an important part to know, and we're going to learn so much more about skin care and skin evaluations because we've got a dynamite team sharing that information with us today. Stay tuned. Welcome back. Dr. T, for families of color, what have you noticed as a trend for contacting your office? I think you mentioned briefly hair loss, but can you be more specific about that?
Well, Jane, there is a type of hair loss that is mainly in African American women mostly. It could happen in men, it could happen in white people, but it's mostly in African American. And I'll tell people this is particularly a problem in the Americas and in the Caribbean area. It doesn't really happen in Africa. And this hair loss is called CCCA, and it is a hair loss that is mostly in the frontal area, but less likely on the back area, and it's a scarring hair loss, and it is actually treatable if we get it early. Now, we sometimes have people who come in who has had hair loss for many years, and they say like, okay, but I just found you now do something, and then I'll have to tell them that there's not much I could do with this, because it's a bit late.
Gabby, one of the things, of course, that we see is that so many of our young kids, because my population is teenagers, and I see so many kids start to wear extensions at a very early age. Is that something that's likely to show up in your office? Young teenagers who've had these extensions or, hair pieces?
Absolutely. We see it in teenagers, we see it in young kids. Hair care practices do contribute to hair loss, different type of hair loss, mostly traction alopecia. So we try to encourage our patients to switch up their hair care practices, wear looser braids, don't braid as tight to the scalp. If a hairstyle hurts, it's probably not good for you. Things like that. And that more so as a community, we need to just try to change how we think of hair. Like growing up, it was like, okay, if you got your hair braided, it needed to be tight. Your hair you needed to see your scalp. And now we're starting to learn and change that trend.
That's an important part. You mentioned the Black community, and there's always one issue that I would like to talk about, and that is that the belief that melanin in Black skin protects the skin from aging. I always heard that, when I was young. There was a saying, black don't crack, and that it protects Black skin from the sun and UV rays. And so, Dr. T, you know, is there some truth to that, or is it just exactly what it is, like an old wives' tale?
That is a myth. You know, the melanin in the skin also causes hyperpigmentation or black discoloration or brown discoloration after an inflammation. So that means that after you have your acne, people come to me and say, like, my acne is not gone. Your acne is gone. The brown spots are not gone. After you have a dermatitis, the dermatitis is gone, but the spots are still there, and that is all caused because of ultraviolet, because all caused of sun. So now I have to teach my black patients that they need to wear sunscreen, and they always give me this look. They're like, sunscreen? So like, yeah, but not white people's sunscreen. You have special sunscreen. Because this sunscreen not only protect you from ultraviolet, but also protect you from visible light and from infrared light. So these are the type of sunscreen that people of color need to choose.
So when you say sunscreen, now when I go to the drugstore, I see all these numbers. I see like 20, 10, 50, 30. I mean, what do I choose? How do I know to go in and just get an over-the-counter product? What do I pick?
Number one, you pick one that feels good on your skin. Number two, you need to look at the ingredients, okay? The number, the SPF number doesn't say anything, because that means sun protective factor. It protects you against sunburn. So SPF 20 versus SPF 30, the difference is very minimal. But most people, nobody ever use sunscreen like they're supposed to anyway. They use way too little amount of sunscreen than the number on the bottle. So the number, yes, the number is not important. The content is more important. I always tell people, I tell my patient, use sunscreen that has zinc oxide or titanium dioxide in it. Zinc and titanium, they're both metal, and we call it physical block. And for people of color, I tell them, use sunscreen, pick sunscreen that has color in it, that has a tint in it, because the tint is usually made of iron oxide, and that iron protects your skin against infrared and visible light.
You know, that's important information. Now, after Dr. T gives this information to the patient, I'm curious, do they come back and say, Gabby, do you use your sunscreen on
every day?
I bet they do. I bet they do.
Every day. I usually get the, oh, your skin's so pretty. What do you do? I wear my sunscreen every day. And then I usually walk those patients up to the front counter and showcase the tinted sunscreens that we do offer in office, so that they can get a feel for them, see what matches their skin better, and make a selection that works for them.
Welcome back. As you can see, we are having one interesting conversation today. And as you know, one of the things I remember is that Bob Marley's story of him having been diagnosed with melanoma, and that was ultimately the cause of his death. And that just really resonated with me. You know, now, as a patient coming in, what kinds of signs should families be cognizant of? Should they have any concerns about skin changes?
Well, Bob Marley died of a melanoma from the nail, the big toenail, actually. And that is actually the most common location of melanoma in blacks.
The toenail?
Toenail. So you need to make sure that you watch your toenails. I mean, your finger and all your nails, you know, finger and toenails. But the toenail is the most common location for melanoma in black.
Wow. Wow.
But that's another myth also, that people think, like, I'm black, I'm never going to get skin cancer.
Right.
That's wrong. People get people of all color get skin cancers. Yes, if you are lighter in color, you're more likely to get more skin cancer, but it doesn't mean that people of color cannot get skin cancer.
You know, and I have to say that I also believe that, you know, very rarely did I ever hear about Asians getting skin cancer rather. And so like a lot of people, I sort of fell into that lot of being disbelievers. Now, Gabby, are there other skin conditions that you all pick up that, well, believe it or not, they turn out to be skin cancers? I mean, for example, like dark spots or bumps or that kind of thing?
Sometimes patients come in and they're like, oh, I've had this spot, it's a rash, it's itchy, it's been there for 2-3 years. it's just a rash. I've used these topicals. That's not working. And then we look at it and we're like, okay, that's a skin cancer. Then we go ahead and we biopsy it. We get the diagnosis, and then we learn that it's a skin cancer. So for a lot of patients, they tend to look up their symptoms on the internet. They read whatever they see on the internet. They're like, yeah, that can't be skin cancer. Google says it's just, this itchy rash. And they delay calling the doctor's office. They delay calling the dermatologist when we could have treated something years prior.
That's important, because when the delay, because one of the things you said, Cynthia, was that, by the time they get to you, it's too late. So if we have doubts about certain things, are there certain signs that we need to look for? In other words, it is time at this point to call the dermatologist.
Anything that changes on your skin, if it's not there before, it is now there, that's time to call somebody about it, okay? Change in color, change in size of anything, change in sensation, it start getting itchy, start getting painful, it burns, it's time to see somebody. Something that doesn't assort, it doesn't heal in 5 weeks or longer, that's time to see. That's how Bob Marley's thing started. He has a sore in the big toe. He's a big soccer player. He has a sore in the big toe. He thought it because he hit the soccer ball wrong, and he delayed treatment. He delayed treatment for a very, very long time. By the time somebody looked at it and treated it, it was too late.
It was too late.
So, yeah. So for example, if you look at their nail, if you have black spots, black lines in your nail, you need to get that checked out.
I think for a lot of folks, we don't even know what a total skin check is. We go to our primary, we got a cold, we'll take care of that. But in terms of having, like a self-care skin check, what does that mean?
Well, it's been it's been said that it's very uncomfortable, and it's even worse than going to a gynecologist, because we actually look very close at your entire skin, very close to you. So you got somebody, and one of my assistants tell me that it's just like little monkey looking for fleas. That's exactly what we're doing. We look very close, and sometimes with a magnifying glass, and do all the spots, and that's what we do. So sometimes it's very, people are...
They feel like it may be a little invasive.
Yes.
Welcome back. Well, you can see today is so informative. And one of the concerns that I've had, certainly personally, and so many people of color, is the experience of keloids. And so I'd like for you to talk a little bit about keloids and how it impacts so many different communities, and so that we have a better handle on it.
Keloids are excessive scarring, and sometimes those scarring could be very big, very deforming, and very painful and heavy. You could get that from surgical scars, or you could get that from cosmetic procedures that didn't go well, like piercing.
So people have to be very conscious when certain things happen to make sure. I mean, are there things that you can do to prevent keloids, or if you're just sort of wired that way?
Well, there's another thing. Not everybody makes keloid. And then there are some people who are notoriously making keloid all the time. That is in one of our questionnaires. So like, do you make keloid? Do you have any history of keloid? So number one is there is a genetic predisposition to get keloid. Number two, there is also, and this is probably people do not know, there is also a certain age where you are more likely to make keloids than others. So if you are in your puberty, around the age of 15 to 18, that's where you're most likely making keloids.
Oh, I didn't know that.
So I tell my patients, if you want to get your ears pierced, get it done when you're very young or when you're an adult. Don't get it done during teenagers, because that's when you're more likely to get keloids.
Now that really is important for our audience, because our show is really directed toward teens, so teens pay attention to that. Now, another interesting condition that we grew up with is the whole concept of ashy skin. Boy, I heard that all my life. Don't go out of the house with your skin being ashy. So Gabby, do they talk with you about that, or do they, say, you know what, do I need to talk to Dr. T about this?
We see quite a bit of patients that have dry skin. We see it in patients of color. We also see it in our patients not of color. One of the things that I think are different is our community grew up with don't leave the house ashy. So at a young age, you're trained to apply moisturizers, whether that's a lotion, whether that's a cream or an oil, every day before you left the house. Whether that's true for other communities, I can't really speak on that. But we do see patients, especially as they age, that notice, hey, my skin is a lot more dry. I didn't have this problem as a kid. I'm applying moisturizer 2-3 times a day, whereas when I was younger, once in the morning was fine.
Are there some general tips, Dr. T, that you would provide, to the audience with, moving forth? This is important as far as skincare is concerned.
Sunscreen. We mentioned that earlier, but that's what I tell everybody. Of any color, you really need your sunscreen to prevent aging, to prevent brown spots, to prevent skin cancers. And then moisturizers, we talked about it earlier too, and that is also very important. And if I may give a tip, pick a moisturizer that has ceramides in it. Ceramides is the oil that is naturally occurring on your skin, and that's what you want to pick.
And as far as ceramides, sunscreen, what about cleansing? Is that important? Because I remember when you were growing up, they didn't say you had to wash your face every single night. It was as long as you walked out the door and your face was clean, it was okay. But there was no routine as far as nightly procedures. Is that critical now?
Jane, I'm so happy you mentioned cleansing. We haven't talked about that, but cleansing, everybody was saying like, I'm cleansing with this special fancy cleanser or whatever not. But what's the goal of cleansing? The goal of cleansing is to get rid of environmental dirt without drying your skin. So any cleanser that doesn't strip the oil out of your skin.
Well, you know what? We have learned so much today, and we have so many more questions. We're going to have to invite Dr. T back, as well as her famous assistant, Gabrielle, to make sure that they come back and give us some more tips on maintaining what we call good overall skin care. One thing we've learned today, when in doubt, make sure you consult your dermatologist. This is a very important lesson for today. So until next week, I'm Jane Marks, and this is From the Heart.